Okay, so thank you guys for coming out and seeing me. My name is Dr. Jairo Cruz Jr. I'm a podiatrist. I work in South Tampa, North Tampa, and Brooksville, so I'm kind of all over the place. And so I thank you for having me here and talking with you guys and giving you some knowledge about common foot pathologies that can happen to everybody. So this is a very informal lecture. So if you have a question, feel free, raise your hand, say, hey you. If you don't remember my name, whatever, just raise your hand, yell out the question, and I'll answer it to the best of my knowledge, okay? I could talk about feet all day, so if you could just make sure that at like around 15 minutes from now, 10:35, that I'm slowing down so I can open up the floor to questions, okay? If you want to ask your question during that question and answer period, that's fine. You can wait 15 minutes and just remember your question, but if you want to just say it, just say it. Okay, so no big deal. So a little bit of a background on me. I am from Chicago originally, born and raised. I moved to Tampa 3 years ago for the job. I have a wife and 2 kids. My kids are, my boy is 5 years old and my daughter is 7 years old. She just celebrated her birthday on the 26th of December. So she gets triple the gifts, which is awesome. I think at this point she's had 3 birthday parties because we had to make it special, separated from the holiday. So we moved down and we're not looking back because that weather up in Chicago is horrendous. So it was funny though, when I was there, my kids are super excited because they don't remember snow. And so it snowed and I said, guys, let's go play with the snow. Like, what are we going to do? I said, we're going to shovel the driveway. And they go, yay! so I sent them out, and they're running up and down the driveway with 2 shovels, and they had a blast. So we're blessed, right? The children loved it, and then it was a great time we had in Chicago. So, but to get back on the topic, the first topic we'll usually cover is fungal toenails. If anybody's had a problem with discolored toenails, or thickened toenails, or toenails that hurt, or toenails that hurt when they're in your shoe because the shoe is pressing on them. It's a very, 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 very common thing. And so it's something that we see at least 30 to 50 times a day, okay, in several different patients. Patients ranging from 20 to, I think our oldest patient is 103. So we see the full gambit of that disease state, okay? So luckily, it's a disease or a thing that exists that doesn't, it won't take you from this world. So we're not really too worried about it, okay? We'll treat it to make everybody comfortable, but we're not really worried about it causing really bad effects on the body, okay? So if you have it or if you're suffering from it, there are several things we can do, okay? Typically, we go the conservative route, which means we will apply certain topical medications to the nail, which have antifungal medications in them to make it less fungal, less discolored, less thick. The problem is with these topicals is that they don't work very well. They work about 8 to 12% for people, okay? Which is not a lot, okay? If it was 70%, then I'd say, yeah, go buy it. Everybody go buy it now. But it doesn't work that well as a single agent of therapy, okay? So therefore, we combine it with a bunch of other things. So we combine it with dremeling. We actually take a burr and thin out the nail so it's actually less thick. And that does 2 things. It makes it less thick so the medicine can penetrate better, and also it gets you comfortable because your nail's not so thick, okay? And I know some of you are probably seeing foot doctors currently for this problem, and I say, continue. You don't need to see me. I don't care who you see. Just see somebody if you have the problem because they can make you comfortable and make you not inhibited in any way regarding your thickened toenails, okay? And there's a lot of other therapies like laser therapy, and there's oral pill therapy. You can take a pill for it. These are all things you can discuss with your doctor or your primary care, whoever you want to talk to about it. They should have the knowledge, and they should be able to tell you what the safety issues are regarding these treatments. And if they think you're deemed eligible for those types of treatment, then so be it. If not, it's a free country. You can do whatever you want, okay? So you don't have to do anything that you don't want to do, okay? Because a lot of people I know are uncomfortable with taking pills, and that's okay. Okay, that's okay. We take enough, right? I think I take 5, so including vitamins because of my hereditary high blood pressure and high cholesterol. And also I don't like to exercise and I like to eat McDonald's, but that's besides the point. So, we all have our things. So that's one topic that we have, okay? The next topic is heel pain. I don't know if anybody suffered from heel pain, but heel pain is very common. Anytime we have new patients, it's usually about 50 to 60% of the new patients that come into the office every day are because of heel pain. Now, typically, it's in the more active crowd or a demographic, but nonetheless, it can happen to anybody, okay? So the most common thing that will happen with heel pain is you'll take a step in the morning out of the bed, and you'll feel a sharp shooting pain in your heel. And it's very debilitating. You almost have to hobble to the bathroom, because that's what I get up when I get up in the morning. I go straight to the bathroom, right? And so you'll hobble to the bathroom, and then by the time you walk back from the bathroom, you start feeling better because it stretches out. Your foot stretches out a little bit, okay? So heel pain is very common. The nice thing about having common things in medicine is that we find what fixes it very easily, because it's so prevalent that we find things quickly to remedy it so that people get better quicker, okay? And again, we always go for conservative therapy first, okay? We never just jump to surgery, ever, okay? Never, never, never. Unless it's a dire need, but that's rare in podiatry, okay? So what we do is we say, okay, the reason why you're having heel pain is because of inflammation in the bottom of your heel, okay? Your foot is upset with you for some reason, because you walked too much, because you went to Disney World, because whatever, you did something, you stood too long, and then the next day, your foot hurt. Actually, the most common thing I see is people who go to a funeral or wedding on a Saturday, they come in Monday morning with pain because they wore shoes they haven't worn in 2 years, okay? So that's very common. I see it a lot, and it happens. So I know it's happened to you guys. It happened to me. So, so what do? We calm down the foot. We tell it to slow down, don't be inflamed, don't be upset with us, and we do that by, number one, applying ice to the foot, because ice is very good. Ice makes things cold, right? So what happens is your body contracts. It tries to hold conserve the heat from the cold, okay? So the cold comes in, the body says, okay, let's close all the arteries so that we can serve the heat. And it does that, and you keep it like that for 20 minutes. And then you take the ice off, right? Because you don't want to be frozen. So you take the ice off, and the body then opens up all your vessels. It vasodilates your arteries to get blood flow, warm blood back into that part of the body. That effect can last 2 hours. And that effect allows your inflammation cells to get flushed out. So it opens up the vessels and everything gets flushed out so it doesn't hurt anymore. And that's why ice is really good, because number one, it does that effect, but it also does that effect for 2 hours after you remove the ice, which is up to 2 hours, which is great. And that's why we don't usually recommend heat. Heat feels good, but the vasodilation effect, the opening of the vessels so that it flushes out the inflammatory cells, maybe lasts 15 minutes and that's it. So ice is far superior for an acute inflammation, okay, or plantar fasciitis or heel pain, okay? So that's number one, ice. You can always take ibuprofen, which if you like taking ibuprofen, go ahead, just make sure you take it with food so you don't bust a hole in your stomach because it can eat through the layer in your stomach. So we don't want that. And then the third thing is injections. So you can, I don't know if anybody received an injection in your foot before? Anybody? Yes? Okay. So then you have experience. You can tell the other sisters what your experience was like. Typically, doctors are not barbaric, so they will take a cold spray and they will spray your foot so that your brain is distracted. Okay? It doesn't stop the pain. It just distracts your brain so you feel really cold, and then they poke you with the needle. Okay? So that's how that works. Okay? It's called neuromodulation. So you think about something else, and then the pain happens. So it hurts a little, it stings a little, but guess what? It's very effective. It's not a fix, although it fixes some people, but it's not a fix. It's something that gets rid of the pain quickly so that you feel better immediately, because we like to give people immediate gratification. When they come in, they're really unhappy because their feet hurt. Well, we give them immediate gratification by giving them the shot, and then they can go home and say, oh, finally, I feel relief, okay? Sometimes that relief can last 6 months. I have patients who come back every 6 months just for a shot, and that's it. That's how they see me. They just come in, I get the shot, they go back home, and I don't see them for a half a year. So that's not normal, but it can happen, just so you know. So that's 3 things that can control the inflammation of the heel. Then the 2 other things that we do are stretching, which it stretches with the exercise where you're stretching the back of your leg. So stretches where you would lift up your foot against something like a wall and then lean into the wall. As long as you're feeling the stretch on the back of your calf, then that's the right muscle to stretch. Another way to do it is if you're laying in bed or laying on the floor or sitting on the floor, if your legs are stretched out, you could put a towel or a band around the tip of your toes and pull. That's another way to stretch. If you feel so inclined, I can't do it, but if you can touch your toes, that's another stretch. Okay? So if you can hold your legs and touch your toes, that's a great stretch for plantar fasciitis. It's loosening up those bands of tissue and allowing it to not cause as much strain, okay? The final thing is supportive shoes, supportive orthotics. I have a pair of orthotics here. I think they're mine. So these little pieces of blue plastic, they're magical, okay? So we mold these to your foot, and we put them inside your shoe, and they support your arch. Most of us have feet that have an arch when we're sitting with no weight on them, and then when we put our weight on it, when we stand up, the arch collapses. Most of us, okay? I'm included in that group of people. Flattening of the foot is something that causes a lot of pathologies, a lot of problems. The flatter the foot, the more problems usually, okay? So if we prevent the foot from going flat when you stand, then we can prevent a lot of these pains, including heel pain, including bunions, including hammer toes, including neuromas. All these pathologies get treated with an orthotic. So in general, supporting your arch is a good idea. You can do it with an orthotic. You could try it with a shoe. If anybody's diabetic, you could do it with a diabetic shoe. Anybody diabetic? Just two. Okay, so diabetic shoes, you should have them on right now, okay? Because, because that's what you have to do. It's a simple way to prevent things from happening. Yes, sister?
Medicare pays for diabetic shoes. You can get them very inexpensively.
This is true. You can get it either for free, or if you want like a premium brand, you can pay a little extra. The only thing that you have to have is you have to have certain requirements. You have to have certain symptoms with diabetes. Then they approve it, okay? So the doctors, podiatrist, your foot doctor, and your general practitioner will both have to write something to the extent where you have neuropathy, meaning your nerves are not working well in your feet, or if you have poor circulation, or if you have symptoms that show poor circulation, like loss of hair or shiny skin, things like that. These are all requirements that Medicare requires so that you can get approved for the shoes. But yes, in general, we get everybody gets diabetic shoes. It's not a problem. So, but we just have to make sure we do it right because, you know, Medicare makes the rules. And so we don't want to go against Medicare. We don't want to fight the government on that, okay? So, but yes, it is true. And it's a good way to prevent bad things from happening to your feet, okay? No question, okay. So, yes, go
What
ahead.
about buying arch supports in the drugstore when you get new shoes? Are they very effective? Are they strong enough or what?
So the question is, arch supports over the counter at Walgreens, Dr. Scholl's, those type of things, are those as effective as other like custom supports as compared? In general, no, they are not. So they're made for the general masses. They're made for anybody that walks in the store, and they're not tailored to your foot. So that's problem number one. Problem number two is the companies that make these orthotics, they know that if they make the orthotic too hard to actually hold up your arch, nobody's gonna buy them. Because if they put something hard in there in your shoe and it's not fitting to your foot, well, you're not gonna like it. You're gonna be really uncomfortable. If it's custom molded to your foot, that's a different story. It could be hard and custom molded. It's like Cinderella's slipper. She could only wear it and that's it, okay? But if it's hard and over the counter, doesn't usually jive well. So that's why a lot of people who go to these different stores, running stores, and they get all these orthotics and they spend thousands of dollars on shoes and orthotics and they don't like them because it's not their foot. Now, on the flip side of that, some people love them and they get complete relief. And I say, hallelujah, take it, because it's cheap. So go nuts. And if that's the case, buy 50 pairs of them for the year because they probably only last a month. That's the problem with these over-the-counter orthotics. You flatten them out. So, and it's not your fault, it's just gravity. I mean, that's what happens. And they're foam, so they're not gonna last that long, okay? Pretty much anything, any arch support or any shoe that you can take and bend in half, probably not the most supportive shoe, just so you know, okay, as a general rule. And we might as well segue into shoes because we're talking about diabetic shoes and arch supports and all this other stuff. A lot of people come in and ask me, what shoes do I wear? And I tell them, I don't care. And then they look at me confused because it's whatever shoe is comfortable for you, okay? Some people like the $12 Walmart hanging off the rack shoe and it's comfortable for them. But what I have seen, because I bought them before, is that they don't last very long, okay? They don't, because the materials are cheap, they don't last. So if you go with a shoe like SAS or New Balance or Asics or all these running shoes that are out there that are fancy $80 shoes, which you can get on sale on Amazon. I don't know if anybody shops Amazon Prime, you can get them on sale. But if they're a brand name, then the material lasts longer, okay? So that means that you don't have to keep switching out your shoes every 6 months. If they're comfortable, the minute you put them on, that's the shoe you wear, okay? There's no such thing as a break-in period. I don't care what anybody says. Break-in period means that you're augmenting the shape of the shoe so that it actually works for you. You don't want that. You want it to actually work the minute you put it on. Otherwise, you're gonna be in pain, okay? The problem with that is it takes about 4 hours to find a shoe. So you gotta drive from store to store to store to, is that time?
Yes.
Okay, thank you. So you have to drive from store to store to store to find the right shoe, okay? And that's difficult. But is it worth it? Yes, it is worth it. And it may take you less time, and if so, great. The other thing about shoes that I wanted to say was, if you find your shoe, again, buy 10 to 15 pairs of them. Because these companies, they like to cut costs. So they will change your shoe material year after year. You can buy the same model shoe, but it'll be a different shoe and it'll feel different. So you almost have to say, okay, this is my shoe, this is the one I'm sticking with, I gotta buy 10 pairs so that it lasts me 10 years. Okay, and that's if you want to do it stress-free. Otherwise, next year you want to buy a new shoe, you have to go through the whole rigmarole of finding that shoe again and finding something else that's actually comfortable. Okay, that's time. So does anybody have any specific questions?
What is the cost for custom products?
It depends on where you go. For us, it's $290. $290 for the pair. So if that's not feasible, there's always something we can do. But I don't own the business, so I'd have to ask my boss, and he's watching right now. So, but you know, it's exactly. But that's a good question. Yes, please. Oh, question or?
So the orthotics are covered by the inserts are covered by Medicare, and someone.
I wish. I wish.
Yeah, I was gonna ask you, is there professionally anything that could be done to help with that?
I thought the orthotics were covered, like two pair a year. The inserts.
Yes, you're talking about for diabetic shoes.
diabetic
For diabetic
love.
shoes, they give you 3 inserts per year,
Okay,
and so they are custom molded.
but right. So just for the diabetes.
Correct.
What about, so plantar fascia, other conditions, it's not covered?
It depends on your insurance, but
Right.
Medicare,
With Medicare, yeah.
No, it doesn't, and so the supplement won't either.
Nope. it's
Right,
it's really.
That's a real lobbying
I've heard
opportunity.
I've heard patients in the past writing lots of letters and getting things of medical necessity, but it's rare.
Right.
It's rare. So it's like, unless you want to like write your congressman and then, which, hey, more power to you, you know. So, but it's tough to change the laws. Yes.
Would you ever recommend wearing flip-flops?
Would I ever recommend wearing flip-flops? Good question, actually. There are flip-flops out there with arch support. Okay. The only one that's coming to mind, well, there's 2 to come to mind. There's one that's called Flipflops, and I have no ties to these companies, just so you know. But Flipflops I hear are okay. Actually, there's several. What's that?
Bionic.
Exactly. Vionics is another one. What's that company? Birkenstock.
Yeah.
Birkenstocks have these cork things, and they actually kind of mold to your foot because your foot makes the areas collapse, and then the arch support stays there and support. So that's nice too. There's a German company, Finn something. Oh man, I can't remember the name. It's like Finn something, but they're like $350. These are expensive sandals. Okay, if it's worth it, go ahead, you know, and no problem. But the more you find these specialized shoes, the more expensive they're going to be. Unfortunately, it's just the way it is because they're trying to make a profit, obviously. So, but again, if you go to places like Nordstrom Rack or you know, these discount stores, they have these expensive shoes for half the price, which is nice. At least that's what my wife tells me. I don't check the bills, so I just, you know, I just go with it. So happy wife, happy life, whatever she wants to buy, that's fine.
I like that advice.
Exactly. So, any other questions specific?
I'm just curious, I have never been in the store, but I see the advertisement all the time for Happy Feet.
Happy Feet, yeah.
What do they offer?
Happy Feet means well, and they probably help a lot of people, okay? Because they specialize, well, they try to specialize in running shoes, and they try to treat people with foot pain. I'm not gonna say I see all of them coming in after the store. I'm sure some people get relief, like I said, with over-the-counter orthotics. But a lot of the patients that leave there, they come to us and they say, hey, I spent $600 here and I'm not better. Can you help me out?
Oh, wow.
So that happens quite a bit. And so what I actually did was I went to the stores and I actually met with the managers and said, hey, if there's something you think needs to actually be seen by a doc, or because we'll work with anybody. It's not like we're out to get happy feet. So they serve a good product, and some people like it, some people don't. It's with everything. Some people like me, some people don't. That's okay. It's a free country. So so we work with them and say, hey, if you have issues, or if you think this is something bigger than just having a shoe problem, or they need a check for biomechanics and how they walk, well, we do that kind of thing. We check how you walk. We look at your foot structure. We look at everything about the foot and see what's good for you. Because they may think something, but it may not be right. It may need to be tweaked a little. Or they may get it right and you get lucky. That's it. But they're not doctors, so it's not like they got trained in this for 7 years but they know stuff. I mean, they know things about running, especially the managers who've been there for a while, the runners who have run several marathons, and they know some things. And I learn from them as well. And I have no problem with that. That's a nice symbiotic relationship we can have with these groups. But if you ever have a question, call a medical professional or ask somebody else, get a second opinion. It's just time. That's all you have to do is you have to take the time. So, does that answer your question?
Yes, definitely.
Very good. Any other questions for now? Anybody have any specific foot problems that I didn't cover that you would like me to cover? No pain. That's good. I'll take it. And again, who sees a podiatrist? 1, 2, 3. So technically, you should all be seeing a podiatrist. Technically. I'm not saying every 9 weeks. I'm saying every 6 months at least, just to get checked, so that we have a baseline, and then we can make sure nothing bad is happening. Because that's pretty much what I do. I'm like preventative maintenance. I check you, and then I tell you if something's going funny, or if something's happening to your foot that you don't notice, that I notice, and then we prevent that bad thing from happening. Because I'm looking, 10 years ahead. I'm not looking 30 feet in front of me. I'm looking, how can I prevent this thing from happening in the future? And that's what medicine should be, right? It should be preventative. It shouldn't be putting out fires. We shouldn't have to be putting out fires and waiting until your foot's falling apart. Then we treat you. It should be preventing that fire from ever even occurring or even starting. So that is what we do. And we're happy to do it. I'm probably going to come out here again just to drop off better pamphlets. I think I left the pediatric pamphlet there, which, a lot of people say podiatrist, oh, you treat kids only. No, we treat everybody. But it's a pamphlet that's kind of general. Obviously, the same stuff that happens to kids is the same things that happen to adults. So feel free to read through that the trifold there. It's on the table there. I left some cards too if you have any questions. Am I about out of time?
What causes calluses in the middle of your?
Very good question. Very good question. So pressure and friction causes calluses. Okay. So I've seen calluses in everybody. 2-month-old. I've seen them in everybody. So and it's from pressure and friction. So as we age, we lose fat in our feet. We don't lose it here, which I wish we did, but we lose fat in our feet, and it actually moves forward. So if you can imagine, these are my toes and this is my foot. There's usually a pad of fat right here underneath your knuckles on your foot. Well, that actually thins out and then moves forward, and so they call that fat pad migration. Okay, it migrates away from where it's supposed to be, and so when we have that lack of cushion, calluses happen because you're stepping on the ground with your bone hitting the skin, hitting the floor. So it's not comfortable, and it can be very painful. So again, that's one of the things we do, and I know the people who see podiatrists, that's what we do. We shave down those calluses, make them thinner and less hard so that you can be comfortable when you walk. But the other thing that we do is we typically pad you like crazy. We put pillows underneath your feet to have external fat, if you will, to add a pad to the bottom so that you don't have a lot of pressure and friction, okay? The other thing you could do is put some kind of soft insert, memory foam. I know Skechers has a big thing with memory foam nowadays, where they put a memory foam in the insole, and that softens the bottom of the foot when you step on the ground. So that's something simple you can do as well. But typically it's just pressure and friction. Sometimes it's because you have a foot deformity. Well, that's different. If you're metatarsal, it's called your metatarsal, but if your knuckle is going into the ground because it's deformed in some way, well, that's a different story. Or if you have a bunion, if you have a little bump on the inside of your foot sticking out and it's hitting your shoe and your shoe's rubbing up against it, well, you're gonna get a big callus there. So there's other things that cause calluses, but typically it's pressure and friction on the bottom of your foot. And we shave them down, make you feel better, pat it, lotion, if you wanna apply lotion every day, twice a day, onto the bottom of your feet where you have those hard lesions, perfectly fine. Don't put the lotion between your toes. That makes it a breeding ground for fungus to grow. So we don't want that, not between your toes, but on the bottom of your feet, on the top, no problem. Lotion can go there, but not in between the toes. And then you can prevent lesions from getting hard, okay? Does that answer your question? Yeah, okay.
Somebody told me that if you put apple cider vinegar and on callus and like, a cotton ball, every night you go to bed and you put a sock on so that it keeps it in place and it's not breathing, the callus will peel off.
Yes.
Yes, but
No, it's true. It doesn't work for everybody, but it is true. So it wasn't me that you talked to, correct?
No.
Okay. So we do that. We do apple cider vinegar soaks for people with really difficult calluses or big calluses because it does soften up the callus very well. I've had, when I was doing my home health calls in Chicago, a lot of people were just bedridden or just not able to do things themselves. So I'd have the relatives come in and soak their feet in apple cider vinegar with water. And they would do this every day, twice a day sometimes. And in 2 weeks, their feet would look like a baby's foot. It's just soft, but it takes work. That's the problem. And a lot of people have busy schedules, so they have their routine. And now you got to add another thing to your routine, which is about 40 minutes, adding 40 minutes to your day, concentrating on your feet, which is very rare. Nobody likes to do that. They like to get up and go and do their stuff. So if you can spend the time, yes, it'll work. You can use apple cider vinegar, you can use Epsom salt, you can use just warm soapy water. It doesn't really matter. It's something that softens the callus so that it's easier to peel away. That's all it is, okay? But it just takes work and it's difficult sometimes to get down there to the bottom of your foot to be able to reach it. So again, the podiatrist would be able to help you with that. But if you want to do it on your own, my suggestion is yes, soak your feet. After you soak your feet, make sure you dry them completely. We don't want too much of anything is bad, so if your feet are too wet all the time, that can cause fungal problems, infections, which is bad. But after you dry it off, then you take a little nail file or emery board, you know how you file your nails? It can be made out of styrofoam. You can go to Home Depot and get 600 grit sandpaper. It doesn't matter, as long as it's something abrasive, and then you could use it on the bottom of your foot and just rub off the callus. You be gentle, because you don't want to cut yourself, but you just do it nicely, nice and gentle, nothing too crazy, okay? Any other questions? Very good. Well, thank you for having me. You guys stay blessed, and then I'll be back. Whenever you want me back, I'll be back. We have a South Tampa office closer here, so right off of Swann. I think we're pretty close, right? This is so Swann, right next to Memorial Hospital. I don't know if you're familiar with Memorial Hospital. But we're right there next to there, so if you need to see somebody or if you have any questions, feel free to call at any time. We'll answer questions over the phone. We're usually really busy, so just leave a message with the front desk, and then they'll get the message to us, and we'll call you back, okay? But if you have any questions, feel free. I don't sleep. Like I said, I have a 5- and 7-year-old, so just call me anytime, and I'll be available, okay? All right, you guys stay blessed. Very good.